For so many guys, it all starts the same way. This nagging, frustrating pain in the pelvic area. So you do the right thing. You go to the doctor, and you leave with a diagnosis: prostatitis. Sounds simple enough, right? But for millions, this is just the beginning of a really long and confusing journey.
Okay, let's get into this. Prostatitis is actually one of the most common things a urologist diagnoses. But here's the problem: it's wrapped up in a ton of misunderstanding, and that often kicks off this vicious cycle of treatments, mostly antibiotics, that just don't seem to work. It leaves millions of men scratching their heads wondering why they're not getting any better.
And that really brings us to the absolute core question of this whole explainer. If prostatitis means an inflamed prostate, and we're all taught that inflammation often means infection, why are antibiotics, our best infection fighters, failing so often? The answer, it turns out, is like a fascinating medical detective story.
And this story is one you hear over and over again. A guy has this persistent pelvic pain, he gets that prostatitis diagnosis, and he's handed a prescription for antibiotics. But nothing really happens. Or maybe he feels a little better, but then the symptoms come roaring right back. So he goes back, gets a stronger antibiotic. Still, no luck.
Now, it's so easy to think, well, the treatment must be wrong. But what if the problem isn't the antibiotic at all? What if the real issue is with the diagnosis itself? Maybe the key isn't finding a better pill, but actually understanding what prostatitis really means in the first place. Okay, so here's the absolute game changer. Prostatitis isn't just one single thing. It's actually an umbrella term that covers 4 very, very different conditions. And each one has a different cause, and this is the most important part, a totally different treatment plan. The National Institutes of Health, or NIH, breaks it down like this. You've got categories I and II. Those are your true bacterial infections. They hit you hard and fast, or they keep coming back. For those, yeah, antibiotics are absolutely what you need. But then, look at category 3. This is the one we really need to talk about. It's called chronic pelvic pain syndrome, or CP/CPPS. And its defining feature, pelvic pain for 3 months or more with, and here's the kicker, no evidence of infection.
And this chart, wow, this just makes it crystal clear. That massive slice of the pie, that's category 3, the non-bacterial kind. It accounts for the vast, vast majority of all prostatitis cases. So think about what that means. Most men who are told they have prostatitis don't actually have a prostate infection at all.
And look, this isn't just a hunch or some new theory. The scientific evidence on this is overwhelmingly clear. When researchers started digging in and analyzing all the studies on using antibiotics for this category 3 condition, they found the same pattern again and again.
This quote right here is powerful stuff. It's from what's called a meta-analysis, which is basically the gold standard in medical evidence. They take all the best research out there, put it all together, and see what it says. And the conclusion? It was completely unambiguous. Antibiotics offer no real benefit for guys with category 3 prostatitis.
Let's just look at this side by side because it really spells it out. On the left, with a true bacterial infection, antibiotics are the hero. They have a target, bacteria, and they kill it. But on the right, for the much more common non-bacterial CP/CPPS, there's simply no target. The antibiotic is flying blind with nothing to attack. So not only is it ineffective, it's actually risky. You're getting potential side effects and contributing to antibiotic resistance for absolutely no reason.
Which, of course, leads to the million-dollar question. If bacteria aren't causing all this pain and all these symptoms, then what in the world is the real culprit? And this is where the story pivots from just debunking a myth to actually finding a real, effective solution. To find that answer, we have to look way beyond the prescription pad. The solution, it turns out, might not be in the prostate gland itself, but in that whole complex web of muscles and nerves that surrounds it. The problem isn't pharmacological, it's neuromuscular. And this insight from the specialists in pelvic rehab just hits the nail on the head. The source of the pain, so often, isn't the organ, it's the muscles holding everything in place, the pelvic floor. When these muscles get chronically tight and spasmed, they can cause a whole host of symptoms that perfectly mimic a prostate infection. The official term for this is pelvic floor hypertonia. But here's an easy way to think about it. You know when you get a deep, nasty muscle knot in your shoulder that just won't go away and it gives you a killer headache? Well, this is basically the same thing, except that knot is deep inside your pelvic floor, and instead of a headache, it's causing pelvic pain, urinary problems, and all those other frustrating symptoms. So what causes something like this? Well, it can be a whole range of things, many of which are super common in modern life.
Chronic stress and anxiety are huge triggers. So is sitting for long periods of time. Sound familiar? It could also be from old injuries, intense exercise, or even a past urinary tract infection that's long gone but left the muscles in a tense, guarded state.
And you see, because the cause is so different, the treatment has to be totally different too. Effective treatment isn't one magic pill, it's a team approach. You've got specialized physical therapy to manually release those tight muscles. You might use specific medications to calm down hypersensitive nerves, and psychology to manage the stress that's contributing to the tension. Sometimes you even use targeted injections to break that pain cycle directly at the source. So, when you boil it all down, it all comes back to one single thing. The most important step for millions of men to finally get relief isn't some new drug, it's a new understanding. It's about getting past that simple prostatitis label and making sure the right questions are asked to get an accurate diagnosis from the very beginning.
And this really leaves us with a final powerful thought. This whole prostatitis situation is a perfect example of what happens when we treat the wrong problem. It really makes you wonder, right? How many other chronic conditions out there, maybe from irritable bowel syndrome to chronic bladder pain, are we treating with the wrong tools, all because we might be starting with the wrong diagnosis?